Hello, my name is Caitlin Knutson, and today I will be talking about hemophilia. First, I'll talk about what hemophilia is. Hemophilia is a rare disorder where your blood doesn't clot normally because it doesn't contain sufficient blood clotting proteins, also known as clotting factors. These proteins work with platelets to help the blood clot. If you have hemophilia, you may bleed for a longer time after an injury than you would if your blood clotted normally. Hemophilia is much more common in men than women. Small cuts are usually not too much of a problem. The greater health concern is deep bleeding inside your body, especially in your brain, elbows, knees, and ankles. The internal bleeding can cause damage to your organs and tissues and may result in death, especially if it occurs in the brain. Milder forms of hemophilia may not involve instantaneous bleeding, and the condition may not be noticed until abnormal bleeding happens after a surgery or serious injury. Hemophilia is an inherited or genetic disorder. It is most commonly transferred by a faulty gene on the X chromosome. Treatment includes regular replacement of specific clotting factor that is reduced, which will vary depending on which type of hemophilia is present. There are two types of hemophilia. They are A, also called classic or factor VIII deficiency, and B, also called Christmas disease or factor IX deficiency. The odds of having hemophilia A is about 1 in 5,000 men, and the odds of having B are only 1 in 20,000 men. Although the two types have similar signs and symptoms, they are caused by mutations in different genes. Those who have an extremely rare form known as hemophilia B Leiden experience episodes of extensive or increased bleeding in childhood, but do not normally have bleeding issues after puberty. Statistically, 60% of cases of hemophilia are severe, meaning they only have 1% or less of their blood clotting factor levels. Moderate cases make up 15%, and they have about 1 to 5% of their blood clotting factor levels. The last 25% of cases are mild, where the individual has blood clotting factor levels of 6 to 30%. Here are some symptoms most commonly associated with hemophilia. Hemophilia symptoms vary based on the severity. If your clotting factor level is only slightly reduced, you may bleed only after surgery or trauma. If your deficiency is more severe, you may have spontaneous bleeding, which can be a serious problem. Signs and symptoms of severe clotting factor levels include unexplained and excessive bleeding from cuts or injuries after a surgery or dental work, many large or deep bruises, unusual bleeding after vaccinations, pain, swelling, or tightness in your joints, blood in your urine or stool, nosebleeds without a known cause, and in infants, unexplained irritability. The most common symptom in severe cases is spontaneous bleeding that occurs in joints. This is a form of internal spontaneous bleeding that usually occurs in elbows, knees, and ankles. When this happens, you will first notice a tight feeling in a joint with no major pain or signs of bleeding. This is then followed by the joint swelling, being hot to the touch, and being painful to bend. As long as the bleeding increases in the swelling, and the pain will also increase as well. Eventually, movement in the affected joint is temporarily lost. If the bleeding isn't treated quickly, the joint can be damaged permanently. When spontaneous bleeding occurs in the brain, it can be caused by something as simple as a small bump on the head. The list of symptoms are as follows: long-lasting, painful headaches or neck pain or stiffness, repeated vomiting, sleepiness or change in behavior, sudden weakness or clumsiness of the arms or legs or problems walking, double vision, concussions, or seizures. Diagnosis. For someone to be diagnosed with hemophilia, doctors will perform what is called an assay, which is essentially a blood clotting factor test. The test will show how long it takes for a clot to form and if they can form a clot at all. This will determine the type and severity of the hemophilia. The best place to go for testing are federally funded hemophilia treatment centers, HTCs. Doctors will also likely perform medical history tests to see if relatives may have or currently have hemophilia as well. According to the National Heart, Lung, and Blood Institute, Pregnant women who are known hemophilia carriers can have a disorder diagnosed in their unborn babies as early as 12 weeks into the pregnancies. An option for women who are known carriers is a process called pre-implantation diagnosis. This allows them to have a child without hemophilia. During this process, the woman will have her eggs removed and fertilized in a lab. Then the doctors will take the fertilized embryos that are hemophilia-free and implant them back into the woman's womb. Treatment. When it comes to treatment, your doctor will ultimately choose which form of treatment they feel is best for your specific situation. As with everything in the medical field, new treatments and methods are being created and tested every day, so there are many completely different treatments in the future. But as for now, the most common options are the factor replacement products, DDAVP, or desmopressin acetate, aminocaprotic acid, antifibrinolytic medicines. The most common treatment for hemophilia is called replacement therapy. This is where the concentrates of clotting factor 8 for hemophilia A or clotting factor 9 for hemophilia B are dripped or injected into a vein. Factor products are used in two ways: demand therapy and preventative therapy. Preventative therapy is when you have regular injections to help prevent bleeding problems, and demand therapy is when you only get injections as needed. Demand therapy tends to be cheaper and easier than preventative therapy, but you have a greater chance of having complications or lasting damage. DDAVP is given by injection or nasal spray and is used to treat only mild hemophilia. It works by stimulating and increasing stored factor 8. It is only given at certain times, like before competing in a big sporting event, to prevent bleeding. And antifibrinolytic medicines and aminocaprotic acids are used to prevent clot breakdown and can be given with factor replacement products. One major issue that can arise with treatment is when the body starts to make antibodies that attack the cloning factors before they get a chance to do their jobs. The only option we have at that moment is to use stronger doses of. This concludes my discussion of hemophilia. I hope you learned something new. Thanks for listening.